So this patient came in for, they came in for a hysterectomy. They'd had a UFI for fibroid embolization. And these were the fibroids that they had an IUD in place. So they came in for their hysterectomy because they were still bleeding and they wanted a definitive treatment. And they ended up having to abort the hysterectomy because they found what we can see here, which was peritoneal carcinomatosis, just incidentally found. And so the question came up, is this due to, was this due to maybe a leiomyosarcoma that was miscalled a fibroid? But looking back on our MRI, they looked just like fibroids. But my fellow made a great call, which is that he looked on the lung windows. Oh, whoops, this is not working. Okay. And when you go on the lung windows, you can actually see that there are innumerable polyps within the colon, all throughout the colon. And going back to the regular window. There was basically a mass in the descending colon here. So this was a case of unsuspected FAP and or familial adenomatous polyposis. And what was unusual in this case is that she had no family history of anything like that. So we were discussing the case, and basically the teaching point is that FAP is not always familial. So you can have actually de novo mutations that can lead to the manifestation of FAP. And that's because FAP is more of a point mutation. So it's not a number of genes that are mutated, it's a single one. It's the APC gene. And so if the sperm or the egg has a spontaneous mutation in that gene, you could get FAP. And it's usually for point mutations, there's a paternal bias because there's more cell divisions during spermatogenesis. But at least in this paper from Denmark, they found that this was not the case for FAP. So teaching point is basically that FAP is not always familial. It can be from a spontaneous mutation. And if you want to be extremely careful, you should look at the lung windows on your colon, and you might be able to see these very subtle multiple nodules or polyps in the colon.